I am Alya Shakir, CEO at 𝐜𝐭, and today I am delighted to be joined by Dr. Enam Abood, our head doctor and founding director. Dr. Abood, very good to have you with us today.
Thank you very much for inviting me.
So today we thought it would be helpful for everyone to talk about some of the reasons people might be struggling to lose weight, including a high fasting insulin, which is something that I think a lot of, to be fair, GPs don't test for or look at or consider in their advice for people losing weight.
Yes.
I'm on my own weight loss journey, and it's taken me a long time to find my way. And the fundamental missing piece for me was the fasting insulin. And I thought it would be great to share that experience with everyone.
Of course.
Get your expert advice, and also, look at any other obstacles people might be facing. So thank you so much for coming in and talking to us about that today.
Well, thank you for raising the subject, because it's a very important and indeed a vital point that is missing in the struggle for some people with weight loss. When I say struggle, imagine a person educated, knowledgeable about what to eat, not what to eat. They do their exercise, they stick to their dietary program, they go and weigh themselves, and nothing happened. And some of them, indeed, they have gained weight. Imagine, it's so heartbreaking. And then that causes them stress, and then that increases their cortisol level, which can increase then their insulin resistance, and it's a vicious cycle. So thank you for raising the point, and very well done on your own journey.
Thank you.
Let me start by explaining what is insulin. Insulin is a hormone that is produced by the pancreas. Pancreas is a gland that's really more or less in the middle of the body, sitting very near the liver. And its job is to produce different enzymes, but the hormone, the insulin hormone, which is then poured into the blood as a response to us eating. So that's really what the insulin does. And people who have issues with lack of a production of insulin, some of them are really born, or they develop type 1 diabetes at a very young age, and they have to take insulin shots for the rest of their lives. And there are people who then develop insulin resistance, and it used to be at later stages, middle age and older, but now it's actually happening to very young people. Children, believe it or not, teenagers, because they have developed insulin resistance. So in those people, they have too much insulin, but it is not working.
And the thing about having too much insulin is it treats the food that you eat differently, doesn't it?
It does. Let me explain that in very simple terms.
Please.
Okay. So when we imagine, especially like if you live in big cities, we finish work and then we want to go home, rush hour. So that happens when we eat a meal. There is a large number of glucose particles, the sugar, then it gets broken down into the digestive system, and then it gets absorbed. So then we have very small glucose particles running in the blood. So those glucose particles, there are the passengers in the station. They are waiting for the train, the insulin, to then take them to the first station, which is the liver. So some of those passengers, those glucose molecules, will get off the train into the liver. They're going to be processed there. They're going to be stored as glycogen. And so this is one station. Second station, it goes to the muscle, and they will be then stored into glycogen. We need also into the mitochondria. We need to mobilize and we utilize them. Third stop will go into the fat cells. We need fat, but we don't need too much of it. And then the passengers, everybody is happy. Right? So that is what it happens normally. Now, what happens in insulin resistance? Same process happens. passengers are there packing the station, trays are there, insulin is there. Then everybody is in, gets to the liver, and the liver says, don't want them. The liver now is rejecting them. So then the insulin, the train says, okay, let's go to the muscle, and the muscle say, why would I accept them? Liver doesn't want to, me too. Then the fat cell says, oh, everybody welcome. Come in. So then we increase the fat storage of the glucose, which means the fat deposition will also increase. And that, with time, will also increase the insulin resistance.
It's a vicious cycle.
It's a vicious cycle until a stage comes where then people start developing diabetes, because then the passengers, they just say, okay, we can't handle this anymore, so they stay in the blood. They don't want to go to the stations anymore, you see? That's how diabetes starts.
Right. And the weight management challenge when you have insulin resistance or high fasting insulin is that the food you eat isn't used for energy in the same way. So one of the things that I found was I'd eat and then I'd either still feel hungry or the food wouldn't give me the energy that I would expect food to give me, right?
Because it hasn't been metabolized in the right way.
Exactly. So I thought that, okay, then I need more food, but that's not the case at all. Or you eat just because you're feeling tired and low energy. But actually what was happening, as you say, is all of that was just converting into fat storage.
That is correct.
Right. So one of the things that I have changed, which has helped me a lot, is I've started intermittent fasting. So I will stop eating, say, around 8 p.m. And then I'll eat again at around 12 p.m. the next day, right? And as I understand it, that is an effective way to help your insulin levels. How does it help your insulin?
I'll give you just a simple parallel example. Let's say I have injured my arm, broken a bone. So what do? Don't we put it in a sling to make it, give it time to relax, and don't use it until it heals itself? Every time we eat, whether it's a meal, whether it's a snack, whether it's a chocolate bar, whether it is whatever, the pancreas has to respond by producing insulin. So if we allow it time to relax and reduce that insulin level, that will pay dividends. So that's really how it works. Intermittent fasting might not work for everybody. Some people might wake up hungry. So even then, perhaps a boiled egg, piece of avocado, half a medium avocado, something simple that doesn't really, so it is really good fat and good quality protein.
And it doesn't cause a glucose spike.
It doesn't cause a
that
glucose
would require
spike because there are
insulin to be released
no
at a high level.
Exactly.
Right. That makes total sense. So, which brings me on to my next question. So, obviously, keto is everywhere. I mean, this is not news to anybody. It benefits quite a lot of people, and other people it doesn't benefit quite as much, or it might benefit temporarily.
Temporarily, yes.
We know that really the best way to eat is to include carbohydrates, but complex carbohydrates in reasonable or small amounts.
Small amounts.
Alongside good quality protein, as you say, and good fats, right? So what is it about reducing the carbohydrates that is so helpful in weight loss?
The source of glucose, of sugar, comes from carbs. So refined carbs, sugars, chocolates, alcohol.
White bread.
White bread, that's what I mean by refined carbs. So it's white bread, pasta, this sort of thing really. When we eat them and they start being digested, so they will give us a very good source, a high source of glucose, which that requires a high level of insulin to actually take them away and put them in the right place. By reducing these, it means we've reduced our need to the amount of the insulin we require. However, that doesn't mean we have to eat more protein, because that then will work in the similar fashion. So portion control is very important.
I was told, and that I looked it up, and it absolutely blew my mind, that if you have insulin resistance and you eat more than 100-gram portion of protein in one sitting, that the body then metabolizes the extra like a carbohydrate. And that honestly blew my mind. I had no idea that there was sort of a limit to the protein that you should take in, you know, because the average steak is what, 200 grams or something like
Yes,
that.
that's
you know?
right.
So that was really, really interesting. So when we talk about complex carbs, what are we talking about?
For example, you can have wholemeal multi-seeded bread, for example, either a small roll or a couple of slices. And I like myself, and I advise my patients, perhaps maybe we go to the sourdough bread, because this is fermented for longer, the gluten has been eaten more, utilized, and also it has lots of holes. So it is really, so it is not bulky. So it's this sort of thing. Wholemeal rice, but I don't think really it's important for the rice if people like white rice. But I would use, for example, basmati rice. It's because it's a fluffy. So small amount give you very, very large.
There's also research to say that if you cook your rice today, refrigerate it, and eat it tomorrow, the glucose spike's reduced.
Definitely, and that applies to potatoes as well.
That's extraordinary. I love that stuff. I love facts like that. It's really good. And then there are obviously pulses, lentils, sweet potatoes, all those sorts of good things.
And vegetables.
Yeah, of course.
Vegetables are complex carbs.
Yes, of course.
Yeah, broccoli, cauliflower, carrots, parsnips.
Do you know what? The day you told me that I could have, say, 6 small baby potatoes with my meal, you changed my life. It was so nice.
Yeah, it's wonderful.
I can't tell you how delicious a baby potato is after you haven't had carbs for a few months.
Actually, I like them cold.
Oh, yeah, they're so good. They're so good. Okay, brilliant. So the other thing as well, I think that maybe I've done differently than my previous efforts to optimize my weight is how I exercise. So what I'm focusing on now is walking, you know, doing whatever steps I can in the day, but strength training, much more than, say, cardio. And I know different things work for different people, but there's a lot of research to support building muscle, to support weight management.
Definitely.
What is it about having muscle bulk that is important in weight management, especially for someone like me with metabolic syndrome?
Building muscle, which is called anaerobic exercise. So there are aerobic exercise when you walk, when you run, when you do steps. And there is the anaerobic exercise where you actually start bulking your muscle. You really mobilize fat to turn it into the glycogen to build the muscle fibers. That is really how you then lose fat, the stored fat, particularly the visceral fat, which is extremely harmful.
And I guess having more muscle means you have hungry muscle.
Totally.
And so when we're talking about the passengers, as you did before, going to the liver and then going to the muscle, I guess having hungry muscle just means less for the fat store? Is that
less for the fat store, because they need more of the energy for them to start building and growing. Because as you know, for a muscle to grow, when you do weight training, you break the muscle fibers. So it is forever healing and building in your muscles, healing and building in your muscles. And then it needs the glycogen, and that comes from the glucose. So it becomes hungry to get more of the sugars going to it.
One of the things that also has really come into my awareness during this journey is the impact of stress, right? So obviously, I'm the CEO of the company. Stress is in my job description, right? Naturally. I probably work with more intensity than maybe I should sometimes, and really need to get things done and all of that. But one of the things I want to raise for people who have really struggled losing weight is the impact of stress
Mhm.
and also sleep, but we could
Sleep,
talk about that
definitely.
separately.
Mhm.
What does chronic stress do in terms of getting in the way of weight loss?
Chronic stress increases the cortisol levels.
Right.
So we have high cortisol levels at any given time.
So just for all of us, what is cortisol exactly?
Again, it is a hormone that is produced, and that's as a response of stress. Also, there are other stress hormones that would be like adrenaline, or adrenaline is the fight or flight response.
Right.
But we have it all the time. It becomes a chronic.
Right.
That actually adds and complicates more the insulin resistance.
Wow.
Mm-hmm.
So having sort of chronic levels of cortisol in your blood impacts your insulin resistance, which gets in the way of your weight loss.
Which gets in the way of your weight loss.
Okay.
But stress, work-related stress, personal stress, we all go through it. And I always say, you see, when you work, you need to have a break during that work. You need to remember the most important factor in any equation of your life is you. So you are really the number one. And the priority has to be given to this person, because you cannot be cloned to do your job when you are not well. So take a break. Take maybe after 2 hours working solid, maybe take a 10-15 minutes a break. Don't look at your screen. Just look outside. Perhaps take yourself away from your desk. Have a drink. Close your eyes. Meditate a little bit. Go back to work. Comes for lunch. Take your protected lunch break. Don't work and eat. That is not the best. Maybe leave the office for a nice walk. It doesn't really need to be fast walk or exercise walk. Just a stroll, just to breathe, just relax. Go back then to your work. Do the same in the afternoon. If you can leave work, perhaps Wednesday, let's say, earlier than usual, that's what becomes your own private time. Just go, sit, relax, do yoga, do Pilates, exercise, do nothing, sit in a coffee shop, watch people go by. Reconvene, make yourself get back together, all your bits and bobs.
I like that, reconvene. That's exactly a really interesting way of seeing it. Bringing yourself back together.
Exactly.
Centering yourself.
Centering yourself, that will help cortisol levels go down.
Right. It's just like the reset for the intermittent fasting of the insulin.
Indeed, absolutely.
We're doing a reset of the cortisol level.
Totally.
That's really, really interesting. And I guess as well, stress gets in the way of our appetite.
Yes.
So it gets in the way of us knowing what we feel like eating, and we tend to maybe reach for less demanding things like takeaways and grab and eat sort of options.
And comfort eating.
Yeah, of course, because we're probably feeling a low-level anxiety that
absolutely,
and so filling the stomach is a way that some people deal with the anxiety. I mean, that's the thing I think about overeating, is that ultimately it's an emotional response.
Yes.
Ultimately, there are some people who smoke, there are some people who drink, some people who vape incessantly. There are some people who eat too much.
Exactly.
And there are also some people who become not very nice people to deal with whatever that is, right? But I guess when you are someone who eats more to deal with that, it's more visible to the outside world.
Of course. Right?
Other things you can probably do more secretly or in a more socially acceptable way, right? So yes, I think stress is such a super, super key thing, both physiologically and emotionally.
And emotionally, but
in
also
the weight loss journey.
It is the commonest cause of body ache, muscle ache, joint pain that we don't even know.
Yeah.
Like, you end of, especially like mid-afternoon or end of a day, you feel knackered, not only just tired, but your muscles are achy, your joints are achy, your joints are inflamed, actually proper inflammation.
I'll tell you a very funny story. Several weeks ago, I had a fall. It happened, right? I was running for the bus, went for it, and I hyperextended my big toe.
Oof.
Right? It was
painful.
It was very painful. And it was a genuine injury, okay? But it healed. Then I started to feel a flare-up at moments of stress. So I'll be sitting in a meeting, for example. I'm just sitting, I'm not doing anything. And someone would say something, or we would have, I don't know, whatever, right? And suddenly my big toe will start to scream. I was like, what on earth is that? And it's absolutely just a stress response.
It's stress response.
Yeah.
It's all the hormones, the stress hormones that we produced.
Yeah, absolutely unbelievable.
And also, you see, that stress can lead to us not being able to sleep, which adds to our stress. Right. And that actually complicates more the insulin resistance.
Yeah, because sleep is connected as well.
It's connected as well. And also, research have shown that people who sleep very late, they actually gain weight, not because they snack, because the insulin resistance gets worse.
Wow.
And the cortisol levels get higher.
That's really, really fascinating. Dr. Abood, I'm really, really grateful for you being here. I hope this has been really insightful and educational for everyone watching. Obviously, in your practice, you support people with their weight management very successfully, with a combination of lifestyle improvements and medication as well.
Correct.
And we're very lucky these days that there are more medical options to support people with resistant weight loss.
Yes.
It's not cheating.
No.
It's just that we are all metabolically different.
Totally.
And some people just need a bit more help.
And also, don't forget, it could be also genetic.
Exactly.
And we cannot really change our genetics, but understand them, respect them, and work with them.
Exactly. So thank you so much.
It's my pleasure,
again
Alya.
for today. And we will speak again very soon, I hope.
Looking forward to that.